Welcome to Economic Forum, where we discuss various issues affecting our economy. Children are the future of the country. But what is most worrisome nowadays is the issue of drug abuse. It is becoming prevalent, and it has got negative effects when it comes to family, it comes to society, and the nation as a whole, because our manpower of the future is drastically affected in terms of their capabilities. And it is in that light that even government has adopted what is known as the Zimbabwe National Drug Master Plan, which is in line with the National Development Strategy in order to deal with drug abuse. My name is John Masugu, and my guest today is Mr. Wilson Box, who is a drug policy reform specialist, who is going to be talking about the situation as it is right now regarding the drugs and drug abuse and how it is being fought from different fronts. Wilson, thank you very much for coming to Economic Forum.
Thank you so much, John.
This issue of drug abuse, just an analysis of its prevalence at the moment so that we have a clear picture of what we're talking about.
Thank you so much, John. I think as a country, from COVID-19, the issue of drug use is the second most pandemic which is affecting our country at this moment in time. And it's so sad that we are losing a generation to new psychoactive substances. I think you've had cases to do with people taking crystal meth, Toriro, you name it. You know, the drugs, there are just many on the market. And it is also sad to note that 60% of all mental health institution admissions is due to substance use in our country. So the country at this moment, if I was going to give a grade in terms of the potence of drug use that we are having, I think we might be at 90%. That is the number of young people who have been affected by issues to do with drugs in Zimbabwe.
Mm-hmm. You have mentioned in Toriro, and obviously it sounds that it comes or it originates from Zimbabwe. But where are these drugs coming from that they are affecting us so much?
We have got traditional drugs that have been found in our country. Drugs like marijuana in Zimbabwe we actually grow, and then we have got new psychoactive substances. These are substances that are being created in labs, and then some of them, they are actually coming in through our porous borders in this country, and some, they're actually coming through the border itself in our country, Zimbabwe. So now with such a concoction of different drugs on our market, our youth especially, and also women, they're actually in a tight situation.
Have you investigated the causes of this prevalence, why drugs are being taken in such large proportions nowadays and they are affecting our manpower?
As an organization, we do have support groups of people who actually use drugs. Why we work with people who use drugs, we believe that engaging people who use drugs, they can also come up with solutions and also tell us what are some of the challenges that they do have. And to some extent, they also advise us or tell us on how some of these drugs will be getting into our country. Some of the drugs, for your information, they are so small, like, the one that they call Mangemba is just a pill, which one can actually get in the street, you see. But the potence or the effect of that drug can actually make someone not productive to the extent that at the end of the day, some of our productive ages, they are losing their lives.
So generally, what is the statistics about drug use in Zimbabwe that we have at the moment?
Our country has not done an official population size estimate, but anecdotal evidence which is on the ground, it points to a lot of illicit drug use in our country. If you go to mental health institutions again, you find out that between 85% to 90% of bed occupancy in those institutions is due to substance use. So there is a lot of illicit drug use in Zimbabwe.
Okay, Wilson, let's talk more about that statistics that you've just given us in the second segment of Economic Forum. So viewers, join us in the second segment. Welcome to the second segment of Economic Forum, where today we are discussing the issue of drug and substance abuse with Wilson here. Wilson Box is a drug policy reform specialist and is looking at this issue to see how prevalent it is and what measures are being taken in order to curb it. In fact, on that note, besides yourselves, who else is involved in this? How is government involved? How is the corporate sector involved? And also society in general?
Thank you so much. There's been a lot of initiatives in place, especially to raise awareness campaigns on the dangers of illicit drugs.
So the first thing is awareness.
Yes, awareness campaigns. And then as an organization, we partnered up with the Ministry of Health through the Mental Health Department and 14 other line ministries to come up with the Zimbabwe National Drug Master Plan. So the Zimbabwe National Drug Master Plan is a document that was put in place by the government through the Ministry of Health, Mental Health Department, and ourselves when we actually supported its writing. And also now we are working to ensure that the document is fully implemented so that it benefits our society, especially people who use drugs.
Let's look at this document, Wilson. Just an overview. What are its contents? What is contained in there? What did you come up with in this master plan?
John, the document has got 5 pillars. There is the supply reduction pillar. This pillar, it speaks of our law enforcement agents to look at the issue of the supply of drugs in the country, how are drugs getting into the country, and also the actions that they can actually take to ensure that we don't have such type of illicit drugs on the market. And then there is also a demand reduction pillar. This is the pillar that looks at awareness campaigns. It also looks at drug use education, the dangers of drugs. And then there is also the harm reduction pillar. The harm reduction pillar, it deals with people with drug use challenges. The ordinary people might want to call them drug addicts. It actually gives a total treatment of people who are addicted to drugs. And then there is also the community reintegration pillar. This pillar looks at a person after having been treated. That person now needs to go back to society. How is he going to fit in? So that is the pillar that looks at that. And then there is the treatment and rehabilitation pillar. This pillar, it looks at services like providing rehabilitation services for people who would have been treated. They will now need rehabilitation, psychotherapy, counseling. So that is how the document is actually structured. And then we also have civil society groups who are also into raising awareness on dangers to do with illicit drug use. And then we've got churches. Yes, churches. They are also in this fight. They are also preaching on the dangers of illicit drug use. We train parliamentarians on policy reform. We also train medical staff, nurses, on how to deal with people who use drugs when they visit their institutions of health. So those are some of the things that we are doing at this moment in time.
Yes. How are you received when you come up with this awareness? Because in some cases, people will not believe that their relative has got problems with drugs. They might bring in other factors, like cultural factors, thinking that it's something to do with family issues. We've known that for a long time. How do you deal with that in order to make sure that people are fully aware that drugs can actually be a danger?
For your own information, John, we are yet to meet a situation whereby we are told that these are some of the cultural issues. As an organization, we are receiving an average of about 60 calls every week from parents with children who have been affected by drug use in this country. Generally, Zimbabweans, they are now aware that we've got a pandemic of illicit drugs in this country, and they really need help.
In order to avoid the contradictory messages, how are you working as a team with all those groups that you mentioned, so that as you go out to the people to create this awareness among them, you speak with one voice? You are going to churches, you are going to schools, universities, and so forth. How do you ensure through this national master plan that you are not contradicting each other?
We have got a mental health partners group whereby we work closely with the Department of Mental Health and the Ministry of Health. So we really share strategies, experiences, what will be happening on the ground, and we all have a common vision that at least by 2030 we have got a healthy young man or young woman in our country, through our messages. The message is very clear. We should actually ensure that people should not take illicit drug use. If they take drugs, then there is need for treatment services.
Yes. Is this a class issue? Is it prevalent in cities, mines, rural areas, and so forth, or you are only thinking of Harare and Bulawayo?
The issue of drugs is not a class issue. It has actually affected almost everyone, but it is the type of drugs that are taken that now brings in the issue of class. You find out that we've got drugs like cocaine. These are expensive, and it's rare to find such type of drugs in the ghettos where we stay. If they are there, they are in small quantities. But in our ghettos where we stay, you find the cheap drugs like Mtoriro, drugs like Mangemba, Bronclear, because they are cheap and they are actually found almost everywhere. But these expensive drugs, you actually find them in all the higher class areas. That's where you actually find such type of expensive drugs.
That's Wilson Box. He's our guest today, and we are discussing drug abuse and how it is affecting society. And we are also unpacking and also relating what is known as the Zimbabwe National Drug Master Plan with the National Development Strategy, so that we protect and develop our manpower in Zimbabwe, particularly the youth. So join us in the third and final segment of Economic Forum. We are now in the third and final segment of Economic Forum, where we have our guest here, Wilson Box, who is explaining to us about drug usage, which we call drug abuse in Zimbabwe, and how it is affecting our economy and all the measures that are being taken. He went further to explain what the Zimbabwe National Drug Master Plan is, that is adopted by government through the National Development Strategy to ensure that we fight drug abuse right up to the end. But also in this segment, let's just look at the economic impact, of drug abuse in the home, at workplaces, and society in general. So many things are affected. So many things also affect, the well-being of a family economically. Let's look at the home. What is it that comes out when the father or the mother, you mentioned women, and the children are taking drugs?
It will be very sad to have a family which has been affected by drug use. Of the 60 calls that I've I've referred to, most of the calls, they are mothers who will be crying, "Mr. Box, my son, is dying of drugs. What can be done?" And unfortunately, at this moment in time in our country, we don't have public rehabilitation centers. The private ones that are there, they are very, very much expensive. So you find out that in the home, if a home forks out, for example, $500 per week to ensure that they treat one of their sons or daughters on drugs, obviously in that home, there won't be any happiness. because of drug use. And then when it comes to the workplace, you know, a worker who is intoxicated is not productive. So a company is going to lose a lot of money because of the affected human capital. So if a company does not sell, a company does not produce foreign currency, it means the government or the country will not have tax from that company. So it means our economy will be greatly affected.
But generally, what reports do you receive from the corporate world regarding their workers, you know, taking drugs, and what measures are taken, what policies are taken at workplaces to ensure that there isn't such a thing?
At workplaces, in most cases, they do have their organizational policies, and if you come to work intoxicated or drunk, in most cases, you are taken for disciplinary hearing, and at the end of the day, if you are caught at the wrong side, you'll be fired. But you'll find out that now the time taken by the company to ensure that someone is is in a disciplinary hearing, it's time wasted. So you find out that the companies, they're actually losing a lot of profits simply because of some of their errand workers who are on drugs. And some of these workers, some of them are committing suicide. So it is a cause for concern because all this issue of illicit drugs, they've got a negative impact on our economy. And we also encourage that companies, they should actually come up with wellness programs to ensure that some of their workers do not partake to issues to do with illicit drug use.
You've looked at the family, you've looked at the workplace. Now let's look at institutions like educational institutions, how they are affected and how promising young men and women, you know, actually cut short their education due to taking drugs at school and through peer influence and so forth.
Yeah, it's very correct, John, to say that a lot of our university graduates, even polytechnic graduates, they are so much into illicit drug use. I remember at one institution in Harare, we actually invited to really sensitize their senior staff members on the issues of illicit drug use. They actually say that most of the young men, they are dropping out from colleges, and then the girls, they are getting some, what do you call them, STIs or... Yes, STIs mainly. It was actually mentioned because they will be intoxicated with illicit drug use. There is also the issue of bullying, which actually happens in these institutions because of illicit drug use. And some of them, they even, threaten their lecturers because of illicit drug use. So we are saying that there is need for more awareness campaigns to these institutions to ensure that at least we produce professionals amongst our young men and women, and also to ensure that at least they stay away from some of these illicit drug use, which are very, very dangerous to their health.
You mentioned that even our health institutions sometimes overflow with people who are affected by drug abuse. How are we managing generally as a country to control in terms of managing the medicines, the personnel, people who are well trained to deal with these issues, be they doctors and support staff?
Unfortunately, our human capital, it still needs to be capacitated because of the new psychoactive substances that are now coming. The first point that I would like to let our country know is that some of our health personnel, they need capacity building, because you find out that some of the drug users, they tell us that they face issues due with stigmatization and also discrimination. So we really need to capacitate our medical personnel not to stigmatize or to discriminate the people who use drugs when they come for treatment. And then there is also the issue of treatment itself. In this 21st century, there are now new treatment methods which can be applied to people who are using drugs. So our medical personnel, they also need to be trained along those lines. So we really recommend that, especially in teachers training colleges and also in nurse training colleges or even at medical schools. I think there should be a component which deals with how to deal with people who use drugs and also how they should be treated. I think there is need for that if we are going to curb this challenge of drug use in Zimbabwe.
Yes. Maybe just to go through some of the issues that you raise when you have visited an institution, you as part of this group of NGOs, government departments, which actually counsel people against drug abuse. What do you tell them about the dangers of drug abuse, and what do you tell them about their responsibility to Zimbabwe today and in future?
What we tell them is that the future is actually in their hands, but illicit drugs, they are not good for their health, because a person who uses drugs at times, if not well treated, there is a danger that there might be the spread of infectious diseases. So there is need for them to be responsible. We also tell them not to discriminate people who use drugs, because some of those people are actually calling out for help, whilst we think that they are criminals. So we are saying that you should actually assist a person who uses drugs, because he is not in a normal state. So that person really needs to be assisted. Mm-hmm. So those are some of the things that we really share with some of our peers when we go to their institutions.
Mm-hmm. That's Mr. Wilson Box, who is a drug policy reform specialist, who has been talking to us about drug use, especially what we call drug abuse, which has become prevalent. And its prevalence has caused a dent on our manpower today and even for tomorrow, because people are no longer able to perform their duties very well. And this, again, is seen due to absenteeism, or even exposing people to danger at workplaces, especially in factories, and the cost of treatment to the family and to the company, as well as wasted education, because, as Wilson said, some actually end up dropping out of school because of drug abuse. So at this juncture, I would like to thank you very much, Wilson, for coming on to Economic Forum.
Thank you so much, John.
Yes. So until next time, on behalf of the production crew, this is John Masu.